Thank you everyone for participating in today's session, Health Equity in WIC, Successes and Opportunities for Improved Services. My name is Darlena Birch. I'm the Senior Public Health Nutritionist with the National WIC Association, and my colleague Quinney Harris, Director of Health Equity and Community Partnerships, will be co-presenting with me today. So to start today's presentation, I wanted to quickly do an overview of our objectives for today. The first item will be discussing the learning objectives. Then we'll talk about WIC. We'll discuss the National WIC Association's health equity work, as well as discuss the successes, challenges, and lessons learned. We'll then go over the sustainability and next steps. We'll summarize our work, and then we'll, if possible, have time for some Q&A at the end. So first, for our learning objectives. Our first objective for attendees is at the end of the session, they'll be able to identify 2 activities that the National WIC Association has pursued to better achieve health equity. We'll list the 3 objectives of the Wise Investment in Our Children, aka the WIC Act. And we'll also want attendees to explain the work of NWA's Infant Mortality Task Force and the Maternal Mortality Task Force. So I want to pause briefly for everyone to take a piece of paper out and to answer the question, what do you know about WIC? And it's an open-ended question, so whatever you know about the WIC program, feel free to write it down on your piece of paper. All right, so now we're going to go into discussing what the WIC program is all about, and hopefully some of the answers you've written down will be reflected in the slides we go through. So WIC stands for the Special Supplemental Nutrition Program for Women, Infants, and Children. And the mission of the program as a whole is to safeguard the health of low-income women, infants, and children up to age 5 who are at nutrition risk by providing nutritious foods to supplement diets, provide information on healthy eating, and to provide referrals to health care. WIC was actually established as a pilot program in 1972, and it was made permanent in 1974. It's administered at the federal level by the Food and Nutrition Service of the U.S. Department of Agriculture. The population that WIC serves is women, infants, and children, as the name implies. For women, pregnant, breastfeeding, and non-breastfeeding postpartum women who meet income qualifications can participate. Infants up until their 1st birthday and children up until their 5th birthday can participate in the program as well. Roughly 50% of infants and 1/4 of all children between the ages of 1 to 4 in the US are actually serviced by the WIC program. And some of the benefits that are provided in the WIC program include supplemental nutritious foods, nutrition education and counseling at WIC clinics, and screening and referrals to other health, welfare, and social services. In 2017, WIC served approximately 1.7 million women. That breaks down to 668,000 pregnant women, 235,000 fully breastfeeding women, and 577,000 total breastfeeding women. In regards to postpartum women, it was 492,000 women who were served by the WIC program. In 2017, roughly 1.7 million infants were served and 3.7 million children were served by the program as well. So what is WIC? Well, WIC is not an entitlement program. And what this means is that Congress does not set aside funds to allow every eligible individual to participate. Rather, WIC is a federal grant program for which Congress authorizes a specific amount of funds every year. So, in other words, WIC is administered federally by the Food and Nutrition Service, as I stated in an earlier slide, but it's also administered at the state agency level, which totals to about 90 WIC state agencies, and that's 47,000 authorized retailers, the grocery stores that are approved in WIC. So when you're trying to do the math for 90 state WIC agencies, it may sound kind of confusing because there's only 50 US states, but that 90 actually includes the 50 US states, 34 Indian tribal organizations, and we abbreviate that as ITOs, the District of Columbia, and the 5 US territories, which includes the Commonwealth of the Northern Mariana Islands, American Samoa, Guam, Puerto Rico, and the US Virgin Islands. WIC services are provided in a variety of settings, and as you can see on the slide, they include county health departments, hospitals, mobile clinics, schools, public housing sites, migrant health centers and camps, and Indian health service facilities. And as I stated earlier, the benefits of participating in the WIC program is that it provides nutrition education, supplemental foods, and referrals to health and social services. So now that I've gone over the WIC program, I want to talk a little bit more about who the National WIC Association is. NWA is the go-to voice of and for WIC leaders. NWA provides member-driven advocacy, education, guidance, and support to WIC staff. And NWA also drives innovation to improve and strengthen WIC for the health of the nation's women, infants, children, and their families who participate in WIC. NWA's mission is to provide our members with tools and leadership to expand and sustain effective nutrition services for mothers and young children. And members of our organization include state and local WIC agencies, individuals, students, retired WIC staff, and industry members whose visions align with WIC and NWA. So now I'm going to turn over the presentation to my colleague, Quinney.
Thanks, Darlena. So now we're going to shift gears a little bit to discuss the National WIC Association's Equity, Diversity, and Inclusion portfolio. But before we do, I would like to take a few moments to think about how do you define health equity? So on that piece of paper that you took out earlier, if you could just jot down what comes to mind when you think of health equity. Any definitions that might come to mind, or just things that you think about as you think about health equity. Okay, next slide. Okay, so a number of different organizations have developed definitions for health equity, such as the CDC, the American Public Health Association, the Robert Wood Johnson Foundation. There's a variety of different definitions. For the National WIC Association, we thought it was also important for us to find what health equity meant for us, since we were going to engage and undertake this work. And for the National WIC Association, health equity is the ability of all individuals and families to achieve optimal health, irrespective of their identity, race, ability, or class. This requires equitable access to nutritious foods, breastfeeding support, chronic disease prevention and management services, safe living environments, and good jobs with fair pay. It necessitates removing obstacles to families' short and long-term health and well-being, including poverty, discrimination, and institutional racism, and other forms of bias expressed through housing, healthcare, education, labor, and other public policies. So as you think about the WIC program, there's 4 distinct pillars to the WIC program: nutrition education, breastfeeding support, the healthy food package, and healthcare referrals. So health equity is embedded into the WIC program, but there are opportunities to expand upon health equity and to further amplify it in WIC. So I would like to talk a little bit now about the work that we've done at the National WIC Association to institutionalize and prioritize health equity. So during the 2019 calendar year, NWA has 6 strategic goals, and one of which was to institutionalize and prioritize health equity in our work as an association. And there are a number of different activities that we undertook as an association during the 2019 calendar year to achieve this. So the first of which I would like to highlight is the Racial Wealth Gap Learning Simulation. This is an activity that we included in our staff retreat at the beginning of the 2019 calendar year. And this particular activity was really essential for knowledge building for staff, and also it helped to crystallize several concepts for staff. 2 specific examples that I would like to highlight are redlining and the loss of land by Black farmers. So for those who are not familiar with the concept of redlining refers to the historical practice of literally drawing a red line around neighborhoods that had a large African-American population by lenders, and lenders denied loans, home loans, to the members of those communities. In terms of the loss of land by Black farmers, in 1920, there were close to 1 million Black farmers in the United States, and today there are just 45,000 Black farmers in the United States. So within a span of 100 years, the United States has lost nearly 900,000 Black farmers and the land that was associated with those Black farms. So if you think about the two of the primary ways that Americans build wealth, through housing and also land that's passed down from generation to generation, redlining and the loss of land by Black farmers has disadvantaged the African-American community, and others in society have been privileged. So that was really, those were really two concepts that were crystallized for staff as a part of the racial wealth gap learning simulation. As an association, we also developed a health equity vision statement, and I actually presented that on the prior slide as I presented our definition for health equity as an association. We also had quarterly lunch and learns for our staff. The topics included equitable systems of care with Dr. Christopher King from Georgetown University. That was our first lunch and learn. Second lunch and learn was health at every size, or HAZE, with Aaron Camacho from CNMI WIC and representatives from the Association of Size, Diversity, and Health and Pinnacle Prevention, I'm sorry. The third lunch and learn was storytelling with Jeff Myers, who actually is my former boss from the University of Maryland Extension, and he's also a certified life coach. And our final lunch and learn was on Dr. James Marion Sims and Medicine's Racist History with Dr. Nicole Ivey from George Washington University. The quarterly lunch and learns were really great to continue to build knowledge for staff related to health equity and specific concepts as it relates to equity, diversity, and inclusion. And it also was really great to build camaraderie among staff. There was, particularly on the lunch and learn that we did around storytelling, there was lots of sharing among staff members, particularly some of the ones who tend to be a little bit more private and not as open. They really open up, so it was really great to build that camaraderie for our team. There were also equity, diversity, and inclusion prompts that we included in our staff newsletter. And this included YouTube videos such as TED Talks. There were articles that were shared from national media as well as professional journals, as well as original pieces that were written by staff and included in the newsletter. For a number of years, the National WIC Association spent time developing a relationship with the Robert Wood Johnson Foundation. And during the 2019 calendar year, we received funding from the foundation for our CREW project. The CREW acronym stands for Catalyzing Retention Efforts in WIC. Those on staff involved in that project include myself, Georgia Machel, Elizabeth Epps, and we're also working with an evaluation consultant, Anthony Panzera. We are currently in the process of implementing that project, and we have sub-awarded 4 communities across the United States to pilot promising practices related to recruitment and retention efforts in WIC. The communities that we funded include CNMI WIC in the Commonwealth of the Northern Mariana Islands, Yakima Valley Farm Workers Clinic in Washington State, Operation Threshold in Iowa, and Adagio Health in Pennsylvania. 2 of the agencies are piloting practices related to the retail environment, and 2 of the agencies are piloting practices related to the clinic environment. We also had a cultural humility general session at our 2019 NWA annual conference that was facilitated by Dr. Jan Mary Garcia from UC Davis. That session generated lots of discussion both at the conference and afterwards after conference attendees had gone back to their home communities. And finally, a carryover from the prior calendar year was our WIC Voices project. And the WIC Voices Project was a nationwide storytelling project by which the National WIC Association partnered with state and local WIC agencies across the country to elevate the voices of WIC participants to highlight the impact of the WIC program on communities across the country. During the 2019 calendar year, we developed a WIC Voices Guide that walks you through the process of developing and managing the project. Next slide.
Great, thank you, Quinney. So now I'm going to talk about some of the task forces that NWA has created that also help the organization address issues of health equity. The first two I'm going to talk about are the Maternal Mortality Task Force and the Infant Mortality Task Force. As I'm sure many, if not all session attendees are aware of, the United States actually has the highest maternal mortality rate of any industrialized country at 26.4 deaths per 100,000 live births in 2015. For other industrialized countries, the maternal mortality rate has been steadily decreasing, but in the US, it's actually increasing. And this rate is significantly higher for Black women. One study found that 46% of African-American women's pregnancy-related deaths were potentially preventable, compared to 33% for white women. And low-income women and women in rural areas are more likely to die during pregnancy. So the fact is that maternal mortality and infant mortality disproportionately affects low-income women and Black families. For example, in Washington, D.C., the infant mortality rate in Ward 8, where half of all children live in poverty, is 10 times higher than the infant mortality rate in Ward 3, the wealthiest ward of the city. So there are massive disparities across the nation regarding maternal mortality and infant mortality. Therefore, in an effort to address the health disparities surrounding both infant and maternal mortality in the US, NWA created two task forces. As I already stated, it's our Maternal Mortality Task Force and our Infant Mortality Task Force. The purpose of these task forces are to examine the available research regarding WIC participation and infant and maternal mortality to identify best practices for addressing the issue while analyzing methods to reduce the incidence of infant and maternal mortality in WIC. Both task forces are working on creating a position paper and report discussing the role of WIC in addressing infant and maternal mortality, and these publications will also identify promising practices for helping to address the issue in WIC. I also want to talk about two other NWA task forces. The first is the Inclusion of Dads in WIC Task Force. And while the W in WIC stands for women, NWA felt it was important to help fathers and partners feel included in the WIC experience. This is something we've heard often from our members, and we often hear that fathers do not feel included. They often feel a little hesitant to participate in the WIC clinic experience. And as a result, this task force was created. The purpose of the task force is to assist state and local WIC agencies in the inclusions of dads in WIC, and it will offer and showcase best practices and steps agencies can take to implement inclusion of dads and other caregivers, such as grandparents, partners, and same-gender couples. And the last task force I want to talk about today is the Environmental Quality and WIC Task Force. This task force was created partly as a result of instances of lead-contaminated water taking place across the nation, and the role of the task force is to examine WIC's role in addressing environmental factors that could impact the health or safety of WIC participants. It also will consider the effects of toxins and contaminants in the water and food supply chain, as well as broader environmental impacts on community health, while also developing recommendations and drafting position statements. Next, I want to talk about NWA's advocacy priorities. And the first two acts I'm going to talk about more or less together. They are the Preventing Maternal Deaths Act and the Preemie Reauthorization Act. In December 2018, Congress passed both these acts, the Preventing Maternal Deaths Act and the Preemie Reauthorization Act. In regards to the Preventing Maternal Deaths Act, this act would provide funding from state maternal mortality review committees, abbreviated MMRCs. And NWA looks forward to working with CDC to ensure that WIC is included in state MMRCs now that it will be authorized and funded. In regards to the Preemie Reauthorization Act, it includes several provisions to research and prevent preterm births and infant mortality, and it also renews the CDC's research on preterm births, as well as the Health Resources and Services Administration's activities to prevent preterm births, extends the Secretary's Advisory Committee on Infant Mortality, and establishes an entity at the Department of Health and Human Services to coordinate federal activities around preterm births and infant mortality. NWA has supported both of these bills, and it aligns with our work. Next, I want to talk about the Mothers and Offspring Mortality and Morbidity Awareness Act, which is also abbreviated as the MAMA Act. This was reintroduced in April 2019 by Senator Dick Durbin and Representative Robin Kelly. And this act is a comprehensive measure to address the crisis of maternal mortality in the country. The MAMA Act implements a set of policies aimed at improving data collection, gathering information on effective interventions, and expanding healthcare and social services for postpartum women. This legislation would create improved access to culturally competent trainings throughout the care delivery system. And notably, this act would extend postpartum coverage for women in WIC to 2 years, a vital step to reducing and identifying risk factors and improving interconception nutrition outcomes. NWA applauds the inclusion of these key priorities in the MAMA Act, and we joined 65 national organizations in endorsing this legislation. The Community Access to Education and Referrals, aka the Care for Families Act, was introduced in June 2019 by Representative Alma Adams, Lauren Underwood, and Bobby Scott. And this bill created $15 million in a funding line item for community health partnerships led by WIC local agencies. The purpose of the partnerships would be to improve community clinical linkages between WIC and healthcare providers, including enhancing referral networks. And this partnership was modeled after NWA's 3-year CDC project, which was in partnership with the American College of Obstetricians and Gynecologists. I next want to talk about the Breastfeeding Peer Counseling Program, which I'm sure many attendees are aware of. And this was a program that was launched in 2004, and it's evidence-based and a resource for pregnant women and new moms participating in WIC. One way in which the BFPC program, which is the abbreviation I'll use moving forward, is that it tackles health equity and uses an evidence-based peer-to-peer model that connects pregnant and postpartum women with paraprofessional breastfeeding counselors who come from the same neighborhoods and speak the same language as WIC participants. WIC peer counselors, who are often current or former WIC participants with experience breastfeeding their own children, provide counseling services in person, in groups, over the phone, via video call, through texting or chatting, and or during home visits. As a result, peer counselors understand the difficulties and provide realistic and practical guidance as a result of shared personal backgrounds and experiences in ways that most healthcare professionals cannot connect. A large body of evidence demonstrates that participation in the WIC BFPC program is associated with an increased rate of breastfeeding initiation, and some studies have also found that participating leads to longer breastfeeding duration and improved exclusivity. Peer counselors are especially effective at increasing breastfeeding initiation and duration rates among African American moms. And in actually this past year, NWA was successful in securing full funding for the Breastfeeding Peer Counseling Program at $90 million. Historically, although it's always been authorized at 90, it's been flat funded since its inception at 60 million. So NWA was very excited in being able to achieve the goal of full funding at 90 million. The last act I'm going to talk about is the Wise Investment in Our Children Act. It's also abbreviated as the WIC Act. And this was introduced by Senator Bob Casey and Susan Collins. The WIC Act expands access to services and streamlines WIC service delivery by providing 3 provisions. The first is extending child eligibility to age 6 or the beginning of kindergarten. The second is extending postpartum eligibility to 2 years. And the third is extending infant certification period to 2 years. So I just want to do a quick knowledge check and ask a question. And if you can remember any of the answers, write it down on the piece of paper you took out. The question is to name the 3 elements of the WIC Act, which I just discussed. And this slide shows the answers. So just to reiterate, the 3 key elements of the WIC Act is to extend eligibility for children up to age 6, extend certification periods for infants for 2 years instead of 1, and extend eligibility for breastfeeding and postpartum mothers to 2 years. So now I'm going to turn it back over to my colleague Quinney to present and finish out this presentation.
Thanks, Darlena. So now that we've discussed different components of the National WIC Association's Equity, Diversity, and Inclusion portfolio, I'd now like to discuss some challenges, successes, and lessons learned from this work. The first of which is that equity is a paradigm shift and it can't be accomplished in a year's time. I've now been at the National WIC Association for 5.5 years. And during my entire tenure at the association, I've been engaged in health equity work. Over time, we built momentum as an association that has brought us to this current moment where we are with our equity portfolio. But there's still a lot more work to be done. So it can't be accomplished in a year's time. You really have to be committed to this for the long haul. The second point I just want to make is that you can't do it alone. Identify a team of champions to help guide the process. So in my role as the Director of Health Equity and Community Partnerships at the association, I provide a leadership role in guiding this work, but it's really critical that each member of the entire NWA staff is working in concert with me on this work in order for us to achieve our goal of institutionalizing and prioritizing health equity in our work as an association. The third point is that it helps to identify topics that your team is passionate about. So when I discussed the 4 quarterly lunch and learns that we held as a staff, one of the topics was on health at every size, or HAES. And we happened to have a team member who's very passionate about weight bias. So she planned that session and she was able to bring her expertise to the table and really her passion shined through for that session. And she was able to identify speakers for the session. She was able to share articles and back information with the staff. So it's really important, if you're going to do similar work at your organization, to use the strengths of your team. Think about where your team members have expertise, the topics that they're passionate about, and that'll help them to be engaged in the work and to ensure that the work will be a success in the long term. Finally, I just want to highlight that there's a lot of support for health equity in this current moment in the public health community. And we've been really fortunate to be able to partner with foundations to fund our health equity initiatives. If your organization is interested in undertaking health equity initiatives, it's very likely there's funding available. It's just really important to align the goals for your work with the work of foundations, government, and other funders in this space. So now I'd like to highlight a few next steps for the National WIC Association's Equity, Diversity, and Inclusion portfolio. First, in light of the brutal deaths of George Floyd, Ahmaud Arbery, Breonna Taylor, David McAtee, and the nationwide Black Lives Matter protests, NWA has taken a more active role in anti-racism work, and I encourage you to read the statement on our website if you haven't already. NWA is also in the early stages of implementing the Advancing Health Equity to Achieve Diversity and Inclusion, or HEAD and WIC project. This project is funded by the Walmart Foundation to the tune of $647,000, and there are 3 distinct phases to the project. The first phase will include an in-depth EDI training for NWA staff to build knowledge and to continue to institutionalize health equity in association work. It will also include identifying 7 health equity champions to serve as project advisors and to coach agencies awarded subgrants during phase 3 of the project. Phase 2 will entail working with the 7 health equity champions, as well as an evaluation consultant, to identify promising practices for integrating a health equity framework in WIC policy, research, and practice. And finally, phase 3 of the project will entail providing 7 subgrants to local WIC agencies to implement the promising practices identified during phase 2, as well as sharing project findings with the larger WIC community at the conclusion of the project. NWA is also receiving dedicated technical assistance from a team of health equity experts provided in affiliation with our CREW project from the Robert Wood Johnson Foundation. We're currently working with them to develop SMARTY goals for the association. The SMARTY acronym stands for Strategic, Measurable, Ambitious, Realistic, Time-bound, Inclusive, and Equitable. Today's presentation provided an overview of the Special Supplemental Nutrition Program for Women, Infants, and Children, as well as the National WIC Association's Equity, Diversity, and Inclusion portfolio, and the work that we've undertaken as an association to institutionalize and prioritize health equity in our work with the ultimate goal of amplifying health equity in the WIC program. We realize that these initiatives are a critical aspect of the work required to achieve the organization's vision of a nation of healthier women, children, and families. And we invite you to join us on this journey. This will conclude today's presentation. Our contact information is listed below. Feel free to reach out to us with questions regarding the WIC program and the National WIC Association's Equity, Diversity, and Inclusion portfolio. Thank you for attending today's session.